Hi, welcome to the Pursuit of Truth. So this is talking on the back of the last podcast, COVID games, as the Prime Minister, I believe, today is going to announce how we're going to live with COVID as if it's not a pandemic anymore. The government seems to, I assume they're going to announce today it's an endemic. I don't know what science they're going to do to do that. I don't know whether he's going to be able to get Chris Whitty and whoever else is now going to be standing next to him, Van Tam, is he still there? I don't know. They're going to stand next to him and say exactly what the government want them to say, because previous to this, all the scientists have been saying that it's rash, this decision of getting rid of everything all at once. So it'll be interesting to see whether they stand their ground as scientists or whether they can be swayed by political power, which is not what it's meant to be. Government is meant to listen to the scientists and then make the decisions. That's what they often say, isn't it? But a lot of the times they ignore the scientific decisions. But I'm sure the journalists, they should be giving the scientists a hard time if they do capitulate to what seems to be the opposite of what science is saying. It's funny how, when you want science, you can use science and science men and women, but when you don't want them, you can just ignore them. Or you just have... See, that's the problem with journalism and with everything, is that there's so many different people with so many different views. Whatever agenda you want to get across, you can find that person to stand next to you and champion it, like an echo chamber. That's the problem, isn't it? It's like on the media. The media, because they're against the government at the moment. I don't know if they do have a Labour identity. Probably not, because they're owned by Rupert Murdoch. I don't know if they are owned by Rupert Murdoch anymore, are they? News Corp. But anyway, and then it's easy for them to just pick a scientist that goes against, like the piece I'm going to show you now. So is it confirmation bias, or is it cherry picking, or is it actually fact and truth? And the whole thing about COVID, and I know a lot of people listening to this, truthers, woke people, or etc., whatever, are going to be thinking, "Oh, we want our freedoms back." Well, you're not going to get your freedoms back. You're not free. No one's free. Not in the system that we live within, because once we sign that passport, we're not free, are we? You were born on this place that no one knows why we're here. That's the truth, isn't it? We don't know that answer. Whether religion fills that question in, or whether, if you don't believe in that, if it's man-made, then, or if it's been co-opted and God does exist, but what we're reading has been altered by those powers and those people who wrote them. Whatever the view, we're not 100% on why we're here. And even if you are going to take the religious view that we're here because we're here to serve God, and we're here to help each other out as humanity, to progress, to multiply, then, the multiplying, we're doing that. But whether we're helping humanity and working as one and serving God, I'm not so sure if God's commandments are looking after each other and looking after everything that we found upon this place. But that's getting off the subject. What I'm trying to say is that we've been given this place, we don't know where we are, who, what, why, the journalist questions, we don't know the answers to those things. And you could do anything. Everyone could have had a great existence where you're able to travel this place and see everything. But you're denied it. You're denied it. Yeah, you are denied it. It's the truth, because you're denied it because of money. You can't go and travel because we've decided that we're going to use the capacity that we've been given, the minds, the skills, and we're going to ask a paltry price for them. We're going to ask you to pay for those things. You can't, just because you couldn't work out how to fly a plane, or you couldn't build one yourself. Well, even if you could, you still have to go through the, registering and all that stuff, and flight paths and passports. So, yeah, I get the point that people want to be free and they want to be able to go back to their normal lives of slavery, of Well, what is the life mostly about for most people? Except unless you're the 1%, or up there with the 1%, who do have the ability to travel, to do all these things that they want to do, and be able to sleep at night when they know that children in other countries are dying and starving and not living a great existence. Most of us don't have that ability. And for those children and men and women in poor countries and countries where they're just fighting each other, just for bits of land that they're never ever going to own. Like John Lennon's song says, you can't take anything with you but your soul. You because you can't. So your ideology is going to be, this is my land. I'm patriotic. I'm going to defend this piece of land until I die in 90 years, and then my son or daughter is going to defend this piece of land. What a waste of time. That's a caveman thought. That's old ways. Wake up. Wake up. Wasting our lives. Humanity is wasting its existence on these futile, stupid things of possession and greed. And it's getting in the way of us helping each other out. It's getting in the way of, and you may think, well, no, if we did that, there'd be anarchy. Well, possibly there would under the system that we've bred and the people that we've schooled. But if we school people differently, if we school people, like I said in the last one, that everyone believes in humanity being one, then we wouldn't have all these problems. We wouldn't have crime. We wouldn't. We'd have a small amount, because there's always going to be a small amount. But remember, a lot of the things that we live within, a lot of the things the faults that are happening, is because of the way we're taught, and because of the system that we live within. Why do people do crime? Do they do it because they want to do it? Most people isn't. It's a necessity because of money, because they need drugs, because their life is so shit, because they can't stomach it. It's that bad. People committing suicide. Do they want to commit suicide? Do they want to end their life and never live again and never see those people that they love so much? No. It's because of the system. The way that we're slave to money. The way that we're slave to these old ideas. Anyway, this is getting off the point that I wanted to make. What I wanted, this piece is, Sky News spoke to someone from the British Medical Association that echoed the things that I said in the COVID games, and I just wanted to put that out there, because sometimes I say things and maybe some people do research things, but they should be doing. Everyone should research everything as much as they possibly can to try and get to the truth, because it's your individual. Only individually can you find truth. Someone can't tell you the truth. Well, they can, but you don't know whether they're telling you the truth or lie, because humans have the capacity to lie. So it's always your mission to make sure that you are being told the truth, and to try and find that as much as possible. Because unfortunately sometimes people can lie very well, or have loads of people lying with them. But yeah, so he's going to give this announcement today. He's going to say, yeah, get on with it. He's going to say infections are low. He's not going to mention January the 5th that things have changed and that's why infections are low. He's going to say deaths are low, because he's going to produce a graph like the one I saw where it looked high, but for the last few days it's dropped down, but that's because of the weekend basis, and that's a very clever way. If you did a rolling average, I'm sure it wouldn't show that it's too low. But of course, like I say with statistics, there's always a way of manipulating them. I'm sure the scientists are going to say, be cautious, because they can't lie too much. But then I don't think they're going to wholeheartedly back Boris, but I think it's going to seem like they are. So they're just going to say, wear masks and stay distance. But yeah, you can go and live your life. We have to live with it one day, probably because all the people that would have died have already died. And that's where the vaccine isn't really going to work. It's just saving time, because if now we're going to give everything up, these vaccines would have waned and worn out. Maybe there is some immunity in there somewhere, but for these vulnerable and old people, they're out on their own now. And this is what we were protecting them for 2 years, and now that day has come where the old and vulnerable now have to face it, because the government wants to make money, and all these big boys want to make money, and big girls. So here's the British Medical Association with their view, where they actually mentioned January the 5th, which is good. So I was glad that they actually managed to mention that. I'm sure they won't, all the journalists who heard him mention that won't parrot it and won't remember it when we're talking about infections going down, because they're not going down. They're going down because they changed the way that they're collating them. And now, of course, they're talking about getting rid of free testing. That's going to make it even more. Travelling, they've changed things. So soon there's going to be no way to know how bad the virus is, and they won't pick up any new ones because the PCR tests they used to pick to looking for new strains. So we'll be relying on another country to tell us when we need to start checking again. So if there is a very bad strain coming, unfortunately in this country, because of this way we're going, it's going to hit us bad, because we won't see it coming. We'll be back to 2019 again, rather than gradually, slowly coming down and keeping something in place to monitor that. Well, let's see what it says. But here's what the British Medical Association says, and for anyone who's listening to the government, I'll be very wary, because it's your own life and your family members that you may be putting at risk by following a lemming off the... Is it a lemming? Off the cliff. There you go.
Now is the chair of the British Medical Association, Dr. Chand Nagpal. Dr. Chand, thank you for joining us this morning. The government will say that they are just responding to the change in threat to COVID. Do you believe that they're potentially ignoring millions of vulnerable people then?
Yes, I mean, there's no doubt that we've come a very long way over the last 2 years in terms of the level of protection we've offered through vaccination and the fact we've now got treatments for COVID. And so we're in a much stronger place. However, we're certainly not out of the woods yet. We have 11,500 people in hospital with COVID. That's more than the 7,500 when Plan B was announced. We're still seeing, sadly, nearly 1,000 people dying every week. And also hospitalizations on a daily basis is more than 1,000. These are figures that are still quite high. Circulating levels are still very high, 1 in 20 people, according to the ONS, much higher than the daily figures, because the daily figures now are not reliable because people aren't actually getting tested. So we certainly have not seen COVID go away. And our worry is that the message, if you tell the public that they do not need to self-isolate, is firstly, it diminishes or airbrushes the reality that so many people are facing, with more than 1 million who are facing long COVID symptoms, and of course so many who are clinically extremely vulnerable and immunosuppressed, who will be at much higher risk of becoming infected if people are no longer isolating. And we know that in a country like Denmark that have actually eradicated, or they've ended rules around isolation and other measures, that the cases have rocketed. So we think this is a premature decision. It's not based on data, and it's unnecessary at this moment when we should be protecting people. And the government hasn't put in place any of those explanations, but has made an announcement 1 month early, which we believe therefore becomes a political announcement, not one that's based upon the interests of the public's health.
Dr. Chand, let's talk a bit about what this means for not only long COVID, but what this means for detecting other variants.
Well, one of the real worries here is that not only are we hearing about stopping self-isolation as a mandate, but also there's been a lot of talk that the government intends to stop routine testing and in fact charging for testing. And now if we aren't testing, we aren't therefore having proper surveillance, we will first of all not know the scale of infection in the community. We will not know about outbreaks. And the PCR test, which now is no longer the test that's offered if a person is symptomatic. It's now people are asked to do an LFT. The PCR test is used as a basis of sequencing the infection to know if there are going to be new variants. So we're now in a position, or in a place where we're not testing to check for those new variants if we stop testing altogether routinely. So there's a lot of reasons why we should be certainly making sure that we can mix in society safely, and that's absolutely right, and people already are doing so. But to go further and stop testing, charging for testing, and also, more importantly, ending self-isolation, these are measures that do not make sense if the aim is to protect the public's health, in particular those who are vulnerable and those who may go on to suffer long symptoms of COVID.
Dr. Nagpal, we know that Omicron was mild in comparison to, say, Delta. There are a lot of people that will want to just move on. What would be your message to them?
Well, we're very fortunate that Omicron has been a milder variant, and it's absolutely understandable that people who have suffered mild symptoms will think, quite rightly, what is the fuss all about? However, as a doctor, as a GP, I can tell you that there are significant numbers of people whose lives have been wrecked through long COVID symptoms. I have to make referrals for patients to specialist clinics whose lives have not been able to continue, they've not been able to work. So this isn't a flu. You don't have this sort of consequence with normal viral illnesses. It's a very real illness for more than 1 million people who've been suffering long symptoms, and that will continue to happen as more infections continue to occur. The second is about people who, again, as a doctor, I look after and doctors look after, who are clinically extremely vulnerable and immunosuppressed. We have to spare a thought for them. For them, COVID can be a serious illness. There are, as I said, nearly 1,000 people dying every week. For them, it's very real. This isn't an illness that has gone away, and for their families, people are in hospital. So I would say that we need to be able to mix in a safe manner, and self-isolation is part of that.
Thank you, Dr. Chand Nagpal, for your thoughts this morning on Sky News.
There you go. So I expect what Boris is going to do is he's going to try and strike a compromise. Interesting, if they do charge for it, then they can say, yeah, we're still doing testing. But of course, by charging for it, not a lot of people are not going to do it. Same as with the changing from PCR to lateral flow tests. A lot of people aren't going to bother to go into the website and fill out all those details, especially if they don't show any symptoms. So those figures aren't going to be accurate anymore. So I don't know. I know he's going to try and strike a balance, and he's going to try and do that and make us. But the problem is those people who want to hear what they want to hear will hear those little bits, and then they will decide, okay, I'm going to, bring all my employees back to work. I'm going to, get the football pitches all open. All those things that this is what this is geared to. It's for the economy. It's for the businessmen, the business-orientated people who want to make money. That's what we're here for, isn't it? At the end of the day, we're not here to enjoy ourselves. We're not here to live. We're not here to exist. Well, yeah, we are here to exist, but we're not here to live. It's all about money, isn't it? That's what it's all about. And I guess that's what the problem the Prime Minister is going to say. He's in a difficult position. He has to think about the economy. He has to think about everyone. Blah, 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 blah. Because that's his job. And I guess, that is the difficulty when you become someone like that. You do have to make these difficult decisions. And that's why, it's fortunate that people have weathered, and because the numbers come up on the screen all the time, it's normalised. It's got used to seeing 200 people die every day. But imagine if that was your street and those 200 people I know I've mentioned this before, 200 people in your street died, you would know about it. Or 200 people of your family members died, you would know about it. It's just because they're all spread across. So now it's acceptable for 1,000 people to die and us still all carry on and make money. Because that's what it's all about. Because if there wasn't this issue of money, if people worked who needed to work, and there wasn't this idea that you have to do it in an office and you have to have a boss and you have to have all this, because you can't be trusted, you have to be whipped into line. That's what this is all based on, historically, this idea. Then, humanity actually helping humanity out, doing things that are needed, not doing things just for making money. That would wipe out a lot of the businesses that are actually out there, because a lot of the businesses are actually about exploiting humanity, exploiting conditions and trying to make money out of that. If we got rid of all those unnecessary things, we looked at structuring the place that we live upon, we found ourselves upon, in a way that we were just doing the things that we needed to do for each other. Yeah, we need transport. Yeah, we need food. We need medicine and housing and, holidays or whatever. Exploring this beautiful place that we found ourselves, so is having our beautiful souls happy. But some of the things, like the millions of different competitions in pharmacy, in food industry, in car industry, in whatever industry, everyone competing against each other to get that buck, get that dollar, get that pound, get that dime, get that yen, get that rand. All of that is unnecessary. That's a waste of human capacity. We could be doing so much more by all working as a team. I don't know, it sounds so common sense when you say it out loud, but the problem is we're so far away from that how would we ever get there? And who would ever take the time and energy to get us there? Instead, switch off, tune out, drop out, live in a system where there's suffering and pain and misery and half-life. Take care, Daisy. God bless and peace.